Hi, my name's Hannah, and I am a Texas Tech pharmacy student on the Abilene campus, and I'm going to be talking about the dangers of essential oils. So, essential oils are oils that are derived from plants, and so they can be extracts from flowers, leaves, seeds, bark, roots, or a peel of a plant. And they've become very popular in recent years. So many people are using them for various reasons. And I came across a study that found that aromatherapy is the second most common non-pharmacological therapy. Essential oils can be found in homemade and commercial perfumes, cosmetics, room fresheners, food, pesticides, and medicine. So I'm not going to discuss all of these, but you should be aware of these common essential oils and their uses. Like camphor is often used for skin preparations, but also can be used for moth repellent. Lavender is often used for anxiety as well as insomnia. So many people believe that because these products are natural, that they're not harmful. And this certainly isn't true. So essential oils are not regulated by the FDA. In fact, the FDA classifies them as cosmetics. So the U.S. Consumer Product Safety Commission monitors essential oils and unsafe products. And because of this, it's hard to know exactly what is in these essential oils bottles. So you really should be aware of the species of plant, the concentration of active ingredient, and whether this is a reputable company because they could have contaminants in them as well. So I wanted to just go over a few cases that I came across pertaining to essential oils. So an 18-month-old boy swallowed some lavender extract that his mother used for home fragrance. 3 hours later, he was extremely drowsy and confused. His breath smelled strongly of lavender. He was admitted to the hospital, and they then performed an EEG on him, and he had abnormal results. So these can be extremely toxic if ingested. Fortunately, this child recovered, but it could have been a much worse outcome. One other case I wanted to talk about is AJ. She's a 34-year-old woman who loves the sun. She lives in an apartment with a swimming pool, and she can often be found there. So due to COVID, she went online to shop for some essential oils, and she came across a website that had a sale on essential oils. So she purchased a few, and the next day she put the mandarin essential oil on her neck and chest and went to the pool just like usual. But she had to leave early because she had a burning sensation on her neck and chest. She took a shower and noticed that there were several burned areas that turned a brown color. And she then scheduled an appointment with a dermatologist because she was concerned and found out that the mandarin essential oil was phototoxic and it actually damaged her skin and caused dermal toxicity as well as blisters on her skin. So some of these essential oils can be phototoxic, and that's something to be aware of as well. So let's talk about some of the adverse effects that can be caused by essential oils. So certainly you can see an allergic reaction, especially if it's put on the skin, you can have a rash. Photosensitivity, just like we just discussed. Drug interactions, they can be extremely toxic if swallowed, but also when we're talking about children, they have thinner skin and also immature liver. So this can cause toxicity that you may not see in an adult just by putting it on their skin. It can also cause aspiration. Some essential oils have carcinogens in them. And lastly, combustion. So there are known cases in which essential oils have combusted in heat. So you really want to store them in a cool, dry place. So let's talk about some of the dangers of these common essential oils that we discussed earlier. So camphor, if ingested can cause toxicity and seizures. And applying it to the skin can also cause toxicity in children. Peppermint has a lot of different plants that follow under peppermint. So one, for instance, is pennyroyal, and that oil can be very poisonous to the liver. And peppermint oil should never be applied to children under 30 months because that can cause seizures. One other just to discuss is eucalyptus. So swallowing it also can cause seizures. So here are some of the safe directions for essential oils. So you always want to read the label and do your due diligence. So you want to know the name of the plant, the Latin name of the plant, the part of the plant used to make the oil, the country of origin, and how that oil was extracted. So all of that should be easily available to you on the label. Only purchase essential oils from reputable companies so that you know that what you're getting is safe and doesn't have any contaminants in it. Use only as directed on the label. Always store essential oils out of sight and out of reach of children and pets because of the known harmful toxicities that can occur. Do not use essential oils near a heat source. And you also want to store them in a cool, dry place. If ingested, call poison control at 1-800-222-1222. And it's best to avoid essential oils in patients with asthma, epilepsy, circulatory disorders, broken skin, pregnancy, and children. So here are just some frequently asked questions that I've come across regarding essential oils. Is it okay for me to rub essential oils on my baby? So personally, I would not recommend this. If you have a parent that insists on using them, apply only to the baby's feet and make sure that the baby doesn't then put their feet in their mouth. You want to stay clear of the face and make sure to use a carrier oil or a way to dilute it before putting it on the skin because it is so highly concentrated. Can I use essential oils in a humidifier? No, you should not put anything extra in your humidifiers. You can purchase a vaporizer, which is specifically for essential oils, but remember to use caution if you live with someone who has a respiratory disorder like asthma. Do essential oils help prevent or cure COVID-19? Some people may find this to be a funny question. But the Quintessence Aromatherapy Essential Oils group actually posted on their website advertising that their essential oils protected against and cured COVID-19. The FDA had to step in and ask for them to take down their webpage due to these false claims. So you should always remember that essential oils cannot cure or prevent any disease. So let's go over some comprehension questions. True or false? Essential oils may be derived from flowers, leaves, seeds, bark, root, or peel of a plant. That is true. Question 2. Essential oils are always safe to use because they are natural products. B. Regulated by the FDA. C. Medications that can cure or prevent diseases. Or D. Classified as cosmetics by the FDA. D is correct. They are classified as cosmetics. Question 3. Select all the following that are true about essential oils. You should always read the label before purchasing. They should be stored in a dry, cool place. They should be avoided in those with asthma. Or they should be applied to a baby's face if they are fussy. So A, B, and C are correct. Remember, you don't want to apply to the face in children. Here are my references. And I also included some URLs of the photos. Thanks for listening.